Morning, Dr. Owens. So excited to be able to have a first chat with you, hopefully one of many. So with that, would love to have you just introduce yourself and share a little bit about your background and how you have dedicated your career to helping kids and parents get more sleep.
Well, thank you very much for the invitation. My name is Dr. Judith Owens, and I have been involved in pediatric sleep and pediatric medicine for almost 40 years now. My training is as a general pediatrician, but I also have specialty training in developmental and behavioral pediatrics. So one of my focuses really is on supporting and encouraging cognitive development, mood regulation, behavioral regulation, all those great things. And I also did additional training in child psychiatry. So I think what that was helpful for is also understanding where parents and caregivers are coming from when they come to see me in my sleep clinic. I am a senior faculty member at Boston Children's Hospital in the pediatric sleep program and a professor of neurology at Harvard Medical School. I've been involved in clinical work, specifically with pediatric sleep patients now, really since 2000, at least, probably longer than that. And so I see children and families of all ages, from all income levels, all race and ethnic groups, and it's always an education for me. I sometimes I think I've learned everything I could have from families, but there's always something new. And one of the things I pride myself on is really working very hard to engage with and support caregivers. As a mother of two, my children are grown up and moved away now, and not quite a grandmother yet, but I certainly have lived through the doldrums and the challenges of parenting an infant and young child. And so I think bringing that experience with me, as well as my medical knowledge, and I hope a high degree of empathy, really helps the encounters with families to be positive and supportive.
That's great. Thank you. That's a great introduction. And I was so excited to start working with you. I first came across your research in The Self-Driven Child. The authors referred to some of the research that you've done, and you've done so much incredible research. We're excited to be able to tap into some of that and get your additional perspective. So let's hop right in. What are a few of the top myths that you kind of encounter or hear in your position focusing on pediatrics and sleep that it would be helpful for parents to understand this is not reality, but we know that there's a big sort of myth, or there are a lot of reasons why parents think that this may be the case?
Well, I think that probably the number one in the young age group in particular is that sleeping through the night, or sleeping like a baby, means sleeping through with no wakings whatsoever. And I think parents are very surprised to hear that it's normal for infants, toddlers, and beyond to wake up periodically during the night. And the reason that younger children, infants, wake more frequently is because their sleep cycle is shorter. And so they wake up at the end of a sleep cycle. It might be 5 or 6 times a night. And so that's not poor quality sleep, that's normal. Problem comes when, the second myth or, issue that I hear about all the time is night wakings that require a caregiver to be present and to intervene in some way. So to bottle or to rock or pat, and drawing the relationship, understanding between how the baby falls asleep at the beginning of the night are the same conditions that they're going to need when they have a normal wake up during the night. So if they fall asleep with the parent rocking or holding or patting or feeding, then they're going to need those same conditions when they wake up. And so drawing that line between these two issues, I think, is very important for families to understand. I think another issue is how to know when your child is ready for bed. And that's a little bit more complicated issue than it necessarily sounds like, because there's something called the forbidden zone or the second wind phenomenon. And that is the period of time, maybe an hour or so, before our brains are ready to fall asleep, where we have a surge of energy. And that's based in the circadian system. Think about it. One of the things that regulates your sleep is what's called the sleep drive. And the sleep drive builds and builds and builds across the day the longer you're asleep. So in order to allow you to stay awake in that last little period, just before you're ready to fall asleep, you get this bump in circadian alertness. And parents oftentimes interpret that as the child is overtired, because when young kids are, they get dysregulated, they may be a little bit running around, and parents think, understandably, well, we need to put them to bed earlier, when in fact, the answer is to wait until after that forbidden zone or second wind phenomenon dissipate and then put them to bed.
Yeah, that's so helpful. One of the this is a nice flow into the next thing would be your top recommendations. Just before we kicked off here, you and I were chatting about this balance of need for structure but need for flexibility, and the benefits of both of those things and how we can not lose our minds. So maybe the next question really is, what are your top recommendations? But I would love, from those first few points, how do you coach parents, and how do you share on that balance between the requirement of structure, yet the reality of flexibility and not losing our minds along the way?
Yeah, well, I think that that's a very important point. And certainly I see many families who come in who are very concerned because their infant or their toddler isn't sleeping exactly the amount of sleep that some recommendation says they should. And so I talk to them, I try to talk them off the ledge and and help them to understand that you need to put that information into context. First of all, there's always a range of sleep amounts. We never say, at this age, you need exactly this amount of sleep, because all kids are different. So that's one thing. And then I talk about what are other potential clues that your child might not be getting enough sleep. Well, if they are difficult to wake up in the morning at the time that they need to get up and go to daycare or preschool, that tends to be a sign that they're not getting enough sleep. And probably even more importantly is when they're given the opportunity to sleep longer, they do. So on the weekend, for example, when they don't have to get up at a certain time to go to daycare, they might sleep an extra hour or more. And that's really kind of a red flag that they may not be on an adequate sleep schedule for the rest of the week. And then, of course, there's all the mood and behavioral dysregulation that young kids show when they're tired. They don't doze off necessarily, or yawn, or rub their eyes, classic signs of sleepiness. They react to that internal sense of sleepiness by acting out. And I think most parents are sort of getting back to this overtired notion that I talked about earlier. I think parents kind of understand that, but it's important to remind them that those can also be clues that your child isn't getting enough sleep.
Mm-hmm.
I think in terms of sleep schedule, there are a couple things about that. One is that although most young children tend to be what we call morning larks, meaning that their natural circadian rhythm is to go to bed earlier and wake up earlier,
Mm-hmm.
there are clearly some even quite young children who kind of are more on the night owl end of the spectrum, and thus tend to go to bed later and wake up later. And so understanding a little bit more about what your child's sort of natural fall asleep and wake times are, I think can be very helpful, especially if you have some flexibility in terms of setting their sleep schedule. Ideally, the sleep schedule should be the same 7 days a week. But, more and more we see younger and younger children who have a different sleep schedule during the week versus the weekend, as I alluded to a little bit earlier. And I think the third recommendation I would very strongly make is to have a bedtime routine. And that really helps with the transition from being awake to falling asleep. And that can start very early, as early as 6 months. And at that point, it's going to be short, maybe 15 minutes or so, but it's the same series of activities every night that lead up to bedtime and should be enjoyable for both the child and for the caregiver. And, usually we recommend that the last part of the bedtime routine happens in the actual bed. So that maybe brings up one more point, and that's the drowsy but awake. So putting your child to sleep, whatever the age, but particularly in younger children, putting them to bed when they're ready, when they're showing you that they're drowsy and kind of, losing a little tone, and they start being quiet, and putting them into bed then helps them fall asleep more rapidly. And it also allows the caregiver to then leave the room so that the last thing that the child recalls about falling asleep is being in their own bed or crib on their own. Now, I don't in any way, outside of safe sleep recommendations about bed sharing in the first year of life, I don't mean to put down co-sleeping. That's a choice that families make as long as they do it safely. We can go into that in a lot more detail. But I think most parents, at least the ones that come to see me in my clinic, they want their child to sleep independently in their own bedroom. And they want assistance with facilitating that process.
Yeah. Very helpful. So let's move into, and I think there's quite a bit of overlap. There's some of the practices that you described in terms of helping, newborns and very young children start to sleep. How about toddlers, 2, 3, 4, even 5 years old, children that are struggling with sleep? Because a lot of our customers and harbor parents, they are getting ready and learning and dealing with very young children, but also may have, that child may have older siblings, and the disruption that takes place with a newborn in the house, and the kind of routines that were in place may start to shift dramatically. And now you have toddlers who are no longer sleeping, even if they may have been sleeping very well before. What are some recommendations to focus on for a little bit of older children?
Well, I think, as you alluded to, it's important to recognize a stressful situation, such as having a
Mhm.
new sibling come along,
Yes.
and what that experience is like for the toddler who has potentially been used to having all of the parental attention, and to kind of be sensitive to that and ride that out. So, for example, I will oftentimes have parents of toddlers come to see me, and mom is expecting a second baby. And
Mhm.
so I really encourage them to make any changes in their routine or the way that they handle bedtime well before the new
Mm.
baby is coming along, if at
Yeah.
all possible. And that includes making the transition from the crib to the bed, although obviously you have to be aware of safety concerns.
Mhm.
Is already trying to climb out of the crib, you have to transition them to the
Yes.
toddler bed. But, so that they don't, in their minds, associate these changes in parent behavior with the
Mm.
arrival of the new baby. And then also understanding that there may be blips once the new baby comes along, but to really try and ride that out as
Mhm.
possible. So I think that's important. Bedtime routines and also transitional objects, like a stuffed animal or a blanket, for toddlers can be very helpful. And we encourage parents to introduce those if they haven't already. Um,
Mhm.
some of the same principles that we just talked about, putting them to bed drowsy but awake, making sure that you're putting them to bed at the appropriate time in terms of when they're actually ready to fall asleep or close to being ready to fall asleep. Eventually, in a little bit older kids, as they get into the preschool age range, you can start to use rewards for good bedtime behavior and good nighttime behavior.
Mhm.
And that doesn't have to necessarily be a thing. It can
Mhm.
be you get to have your favorite breakfast cereal in the morning, or you get to
Sure.
play a game with mom or dad, we
Mhm.
play the, but it needs to be proximate for kids that age. You can't
Mhm.
say, oh, well, at the end of the week we're going to go up for ice cream, because
Right.
there's
Right.
there's no connection there.
Yes.
Another sometimes blip in otherwise good sleepers happens around 9 months of age, when children are learning gross motor skills like standing and walking, and they're really driven to practice. And so there have actually been studies which have shown this regression in sleep habits around that time, related to that need to master these skills. So that's something that parents could potentially anticipate as well. So a lot of this is what we call anticipatory guidance in the pediatric world. So it's helping parents to understand what's next,
Mhm.
or what are the things that you might expect there's going to be a change or a regression in sleep habits and other habits as well, with the idea that just try to ride it out, and
Yeah.
and as soon as you can, go back to your usual practices. Obviously, when a child is ill, it's an ear infection, or there's something like that going on, as a parent you're going to respond to that during the night,
Yes.
of course. But once that's resolved, then it's really important to get back on the wagon in terms
Mhm.
of what the expectations are.
What a great first chat. Lots of very helpful information. And as I said, the first of many. we'll have some great topics that we can dive into, that we can go much deeper on each of those. Co-sleeping was one of them that you just mentioned earlier. So we'll add that to the list. Any closing thoughts for parents and families listening to this in the first of many conversations to come?
Well, parenting is a journey like anything else, right?
Yes.
And I think it's important, if you have any concerns, medical concerns about your child's sleep, that you bring that to the attention of your child's healthcare provider, and we can talk more about what those possibilities might be down the line. But I think trying to have confidence as much as you possibly can. It's a very daunting task, especially if you're a first-time parent. And you're going to get a lot of advice from a lot of different directions. But trying to have a sense of, if you have a partner or if you have family members who are helping out, to talk to them and have a dialogue with your support system, and use that support system, because this is a tough job.
Yeah. This is great. Dr. Owens, thank you so much for this first chat, and look forward to many more to come.
You're welcome. My pleasure.